Welcome to Well-Rounded Mama's YouTube channel. If you find this helpful, like, subscribe, ring the bell.
I don't have my bell, sorry guys.
Dang it, she failed.
I failed.
We're failing at all the things.
All the things, it's the COVID.
So today's video, we wanted to kind of address what makes an individual low risk. I've been getting a lot of requests for late transports from somebody who is planning a hospital delivery, who is now concerned that that is no longer going to be an option for them, and what does an out of hospital or home birth look like? Obviously, as direct entry midwives, we just care for low risk individuals. And so that's kind of the big question, is what makes an individual low risk? Obviously, as midwives, we like doing those consultations with everybody so that we can make sure that we are getting everyone's kind of specific information. But just be prepared that when you come in, you might be going over some medical history and how this pregnancy has gone and how your private pregnancies have gone if you've had them. And so
for doing records,
just know that the best way to do that is to reach out to any of your local midwives to talk to them. Right now, we are doing some in-person consultations, some phone consultations, some telehealth consultations, some Zoom consultations, whatever the client or individual has access to, that's kind of what we're doing. Just some precautions that we're taking here at the office to make sure that we're keeping ourselves and our clients safe and healthy at this time.
Well, again, that depends on a lot of things. However, typically we're looking for like how this pregnancy has gone for you so far. Is there any, health concerns? Do you have like a history of diabetes? Are you currently being treated for cancer? Like big things that we've talked about in the past that would automatically risk you out. But for the most part, we're looking for minimal complications, those kinds of things that have happened in this pregnancy. In some states, they have requirements. Here in Nevada, we're kind of a gray area, so we can definitely have conversations about what moms want, what they expect out of us.
Sometimes it's hard to kind of publicly say in your community, this is our hard, fast line. And here at Well-Rounded Mom, we do have some hard, fast lines. Different types of breaches we can't take, different types of twins we cannot deliver, somebody with type 1 diabetes, like you said, someone with active cancer, or sometimes even active autoimmune, depending on what medications they're on. There's individuals with blood clotting disorders. Some of them are still good candidates for having a home birth, but without looking at those labs, it is really hard to determine
like
what that looks like. And so what they were saying in a study that we just read recently about home birth, the three big things were AMA. So what is AMA? Advanced maternal age. That seems to be a really big one that home birth midwives take some judgment for taking. However, we kind of view things differently, and we are very lucky here at Well-Rounded Mama and that we do have physicians that work with us and offer dual care with us. And so advanced maternal age starts at age 35, and we see a huge increase in some problems and complications after age 40. However, we also have been trained on what to look for, how to monitor, whether that's growth, whether that's hormones, whatever that is, we know what we're looking for. Oh, sorry, somebody's car alarm is going off.
I think there's a big thing too, because I even have some clients who they're 34 and a few weeks before they deliver, they're gonna be 35, and all of a sudden they're like, nope, you have to go see the high-risk doctor as soon as you turn 35, or because you're going to turn 35 in this pregnancy. And even if everything is going normal and just kind of a boring pregnancy, like nothing exciting or complicated is happening, and they're still being sent to like high-risk doctors for that, whereas we probably wouldn't see that as a risk factor.
Right. That was one of the number ones. The second one that keeps getting talked about is obesity. That seems to be one that we kind of take a lot of hits. Again, as midwives, we've been trained how to candle, how to candle. We can candle it. We can candle it.
Like we can do it.
Oh yeah, the girl with the like Rosie Riveter. We can handle it. Candle it. When it comes to an individual whose BMI is higher than average, then we have been trained for things to look for. We are monitoring. We're monitoring all of our clients for fetal growth. Fetal growth is really important. And so we know how to recognize signs for intrauterine growth restriction, which would be a problem in both of those scenarios. And so if we were to see somebody who was
Like
having a
HR,
problem with
we
that,
send
they
them.
would get flagged and sent in for ultrasounds
Yep.
or seeing
Make
physicians.
sure
And
that's
so
not a problem.
it's one of the things that your midwife's jobs to do is make sure that we know how to refer out.
Yes, and I think it's important to say that like that's happening for everyone. That's not just
Yeah.
happening for like those in
Yeah.
that risk category. Like we do that across the board. I'm always checking for fundal height, making sure they're eating proper, making sure baby's movement's good. We're listening to baby. We're doing all those things to, see if there's gonna be a problem, and we would refer out. And I
sure.
think that's what makes a good midwife is knowing when to refer out, when something needs to have a second set of eyes looked at, those kinds of things.
And then the third thing that gets brought up a lot is the VBAC. So those top 3 things are the things that there's always question about whether they're considered or deemed high risk or not. However, ACOG says especially after one cesarean, that giving a woman the ability to have a vaginal delivery is safer than repeat surgery.
Yes.
And obviously there's factors we're looking for, there's qualifying things that we're looking for, placenta placement, bleeding.
I mean, it's similar in this instance of a physician letting them have a TOLAC or a trial of labor. We're doing the same thing. I mean, we're looking for increased bleeding during labor. We're looking for signs of sinusoidal heart rates. Like we're looking for those things in a VBAC. And then if that was happening, we would transport as well to a hospital. Transporting or referring out isn't just happening prenatally, it's also happening in labor if need be.
At the end of the day, as well-run mama midwives, we say anything that's not controlled. So you may come in and have high blood pressure that's being monitored. The moment we can't control it and it goes above our parameters that we're following in the office, you become now too high risk to have a home birth. Same with women who are a little preeclamptic. Maybe they're a little swollen, maybe something small is going on. We're maybe helping with that herbally or dietary wise. Same with gestational diabetes. If we can get an individual to be controlled, if you see an obstetrician in an obstetrician's office and you fail your 1, 2, 3 hour glucose test, they're just having you monitor.
Unless you need insulin.
Yes, unless you reach a point where you need insulin. It's very rare that we have somebody who tests positive for gestational diabetes. However, when we do have it, we know how to monitor it, look for it, and know when it has become a problem and they are no longer a good candidate for having a home birth delivery. If you have any more questions on that, or you would like some more of like a personal contact because you have something that you're going on that you wonder if you're a good candidate, calling our front desk and scheduling an appointment. Right now, as individuals, we are meeting with people face-to-face, telehealth, all of the things as I stated at the beginning of the video. So just having a conversation with a midwife is always a valuable thing. Remember, most individuals are low risk when it comes to childbirth. It's a different kind of health scenario where maternal health is something that it happens organically, whether an individual is there or not. And our job is to be there to make sure that we know when we have to be in a different location or a different environment. And so we're here to support our local community at this time, especially those that are looking to have alternative options when it comes to whether they want to have a hospital or a home birth delivery. And so thanks for joining us. We really appreciate you. We hope you're keeping safe, healthy, active, finding things to keep you entertained at home.
Social distancing.
The best thing that has happened about this are the memes. I mean, obviously,
memes are great.
Maybe below, share your favorite meme that has gotten through you this hard time, because remember, laughter is kind of that key to getting you through that. And so thanks for joining us. If you find this helpful, like, subscribe, and ring the bell. I'm like, I got stabbed.
Okay.
Okay. Okay.
So cute in our scrubbies.
Oh,
So cute. I wish I could wear scrubs every day.
Yeah, I know. Oh yeah, we are. Every day.
Every day.
Okay. Yay.
Terrible.